Sometimes NCSBN ask questions about preparing menu for the patients with specific disease condition. So we are going to learn basic about the nutrition, and we'll also talk about some diet in specific disease condition. Okay, so let's start. Nutrients. So the first one is carbohydrate. So in carbohydrate, it's a preferred source of energy like sugar, starch, cellulose, and that provide 4 calorie per gram. Per gram, it contains 4 calorie. What are the other sources? Milk, grains, fruits, and vegetables. They are a rich source of carbohydrate. Okay, then we do have fat. So fat is stored form of energy. It helps to protect internal organs and maintain body heat. So to maintain our body heat, fat is very important, and it provides 9 calorie per gram. 9 calorie per gram. If not enough, then essential fatty acids leads to sensitivity to cold and skin lesions, increased risk of infection, amenorrhea in women. So you might have heard of that females who are very, very lean and thin, who doesn't have muscle fat much, they have hormonal imbalance, and because of that, they have irregular periods. So amenorrhea can also occur if someone who does not have enough fat, because fat is needed to have regular normal hormonal function. Okay, so high fatty food. If you are taking too much fatty food, then you are at high risk of developing obesity and cardiovascular disease. Then we do have protein. Amino acids are essential for making proteins. Proteins needed for tissue building and repair. This is very important function of protein. Protein is needed for tissue building up and repair. So sometimes, let's say in respiratory system, when there is tuberculosis, pneumonia, where there is lung tissues are getting damaged because of the infection, we give them high protein diet because we want this tissue, to get repaired easily. Okay, fluid balance के लिए भी it is very important. Produce antibodies, produce enzymes and hormones. So proteins are needed for tissue building, repair, fluid balance, produce antibodies, and produce enzymes and hormone. It provides 4 calories per gram. So same like carbohydrate, it provides 4 calories per gram. Inadequate protein cause protein energy malnutrition and severe wasting of fat and muscles tissue. So you might have heard of kwashiorkor and marasmus like condition in pediatrics, where if they don't have enough protein in their body, they can have muscle wasting. Okay, so protein energy malnutrition and severe wasting of fat and muscle tissues can occur. Then we do have vitamins, facilitate the metabolism of protein, fat, and carbohydrate. Whatever you are eating, like protein, fat, and carbohydrate, for their metabolism, vitamins are very, very, very important. And it promotes the life and growth process and maintain the body function. Fat-soluble vitamins and water-soluble vitamins. We do have two types of vitamins, fat-soluble and water-soluble. So fat-solubles are A, D, E, K. Those are fat-soluble vitamins. They can be stored in the body. So if you are taking them in excess, it can lead to toxicity. For vitamin A, D, E, K, you always have to be mindful taking in, proper amount. You cannot take that in large amount. Okay, whereas water soluble is B and C, and that can be easily excreted out in the urine. Okay, so there are less chance of getting toxicity from vitamin B and C. Then water. So water is very, very, very important for our cell function. 60 to 70% of our total body weight is from water. So you can understand how important it is to drink water, right? As a nurse or healthcare provider, always consider the client culture, spiritual, personal choice when planning nutritional intake. So some of the religion, they let's say they don't eat meat, then you have to consider that into your menu planning, and according to that you can plan different food items for the patient. You also have to consider their likes and dislikes while preparing the menu. If the patient is following vegan diet, then you have to be careful while not adding meat or any dairy product, and also providing them enough nutrition for the patients who are following vegan diet. Okay, all right. Then dietary guidelines for Americans. So what is the dietary guideline? Maintain healthy body weight. That's the first thing. Increase physical activity and decrease sedentary activities. Limit saturated fat, trans fat with less than 10% of the daily calorie from saturated fat. Limit added sugar so that the less than 10% of the daily calories are from added sugar. Consume less than 2300 milligram of sodium per day. Limit alcohol to moderate use. 1 drink daily for women and 2 drink daily for men. And use food safety principles of cleaning, separating, cooking, and chilling. Okay. Now, what they are saying is, so this guideline says that you have to maintain normal, healthy daily weight, body weight, and you have to increase physical activity. You have to decrease sedentary lifestyle. You have to include more fruits and vegetables in your diet. You have to eliminate sugar, salt, and high fatty food from your diet. Okay. And alcohol should be limited to moderate use. 1 drink daily for women and 2 drink daily for men are kind of, we can say that they cannot have more than this. If someone who is drinking, then you can advise them you cannot have more than one drink per day for women, and not more than two drink daily for a man. Now they're talking about some principles of cleaning, separating, cooking, and chilling. So let's talk about that. So we do have four principles to keep into mind: cleaning, separating, cooking, and chilling. So let's talk about the cleaning principle first. So wash your hands and surfaces often. So every time you cook, before cooking and after cooking, you need to wash your hands properly. And whatever surface you are using to prepare your food, it should be cleaned frequently. Germs that cause food poisoning can survive in many places and spread around your kitchen. So this is very important that you clean. Wash hands for at least 20 seconds with soap and water before, during, and after preparing food and before eating. Wash your utensils, cutting boards, or countertops with hot, soapy water, and rinse fresh fruits and vegetables under running water. Rinse fresh fruits and vegetables under running water. So this is about cleaning. So you have to wash your hands at least 20 seconds before, during, and after preparing food. You have to clean the surfaces which you are using for preparing the food. Okay, you have to clean them frequently, and you have to wash all the vegetables, fruits under running water. So that is the principle of cleaning. Then we do have principle of separating. Don't cross contaminate. So that is the main principles for separating. You have to keep everything separate. What is that? So raw meat, poultry, seafood, eggs can spread germs to ready to eat food. So whatever food is, ready to cook, ready to eat. So you have prepared the food and it's ready to eat. And if you are keeping this food along with raw meat, poultry, seafood, and egg, then they can have cross contamination. So bacteria can spread. So use separate cutting boards and plates for raw meat, poultry, and seafood. You need always separate cutting board or chopping board or plates for raw meat, poultry, and seafood. Always needs to be kept separate. Okay, so two principles. What they are saying for the separation, that you cannot keep raw meat, poultry, seafood, or egg with the food which is ready to eat. Okay, second one is whatever utensils you are using, like plates and other utensils and chopping board or cutting board, you have to keep them separate for raw meat, poultry, and seafood. When grocery shopping, when you're going for grocery, then keep raw meat, poultry, seafood, and their juice away from other food. You need to keep them away from other food. Okay, you cannot keep raw meat, poultry, and seafood along with all other food. You cannot. Keep raw meat, poultry, seafood, and eggs separate from all other food in the freeze. Generally, we don't follow this principle, but you have to be very careful. You have to educate to the patient, and also you have to follow these principles that raw meat, poultry, seafood, and egg you have to keep separate than other food items in the refrigerator. Okay, then we do have cooking principles. So to the right temperature. So cooking always should be done at right temperature. We do have few disease condition that we have to learn where if you are not eating properly cooked meat, then you may acquire those conditions, disease conditions. So very important that the cooking should be at right temperature. So food is safely cooked when the internal temperature gets high enough to kill the germs that can make you sick. Okay, the only way to tell if the food is safely cooked is to use the food thermometer. Sometimes, when you watch some of the YouTube videos, or when we cook in our home, generally how we decide that the food is cooked, most of the time our mom or other whoever is cooking, or even if we are cooking, will say, okay, color is changed, right? Now the onion color is changed, so now it is cooked. If this particular vegetable, it color is changed, so it is cooked. No, you cannot go with that. Specifically for the meat, when you are cooking meat, you have to be very, very keen in checking temperature, and that temperature check can be checked by only food thermometer. Okay, because we want to kill all kind of microorganisms. So the only way to tell if the food is safely cooked is by checking the temperature by food thermometer. You can't tell if the food is safely cooked by checking its color and texture. So please keep that in the mind. Use food thermometer to ensure the food are cooked to a safe internal temperature. So these are the food temperature criteria. So 145 degree Fahrenheit for the whole cut of beef, pork, veal, and lamb. Then allow the meat to rest for 3 minutes before carving or eating. 160 degree Fahrenheit for ground meat such as beef and pork. 165 degree for all poultry including ground chicken and turkey. 165 degree Fahrenheit for leftover and casseroles. Okay, leftover meaning if you have cooked previous day and it was leftover and next day you want to eat, so it should be cooked at 165. It should be warmed up at 165 degree Fahrenheit temperature. 145 degree for fresh ham. 145 degree Fahrenheit for fin fish or cooking until the flesh is opaque. So you need to remember this temperature for cooking. Okay, so what I would say is if you're not eating meat or if you're not cooking, then it would be difficult for you to remember the temperature. What you can do is you can remember the range. The range is 145 to 165. So generally for almost all the food item, what is the temperature? 145 degree Fahrenheit to 165 degree Fahrenheit. So you can remember this temperature for any kind of food item, specifically the meat that they are talking about. So this is a safe environment where you can um, cook the meat like poultry, chicken, turkey. Okay. Then about the chilling, refrigerate promptly. So bacteria can multiply rapidly if left at room temperature. Remember, this is called danger zone. Room temperature is the danger zone. Now, what is the temperature? Room temperature means what is the temperature? 40 degree Fahrenheit to 140 degree Fahrenheit is considered as a danger zone. So if you see here, 145 degree to 165 temperature is used for cooking the food. But if you have to refrigerator, you can see here between 40 to 140 degree Fahrenheit is a danger zone. So always remember for the refrigerator, your temperature should be less than 40 degree Fahrenheit. Temperature should be less than 40 degree Fahrenheit. So understand for refrigerator less than 40 degree of Fahrenheit, between 40 to 140 is a danger zone. And for cooking purpose, you are using from 145 to 165. Okay, now never leave the perishable food out for more than 2 hours. Perishable, that means easily kharab ho jaye, वैसा वाला food. Okay, so never leave the perishable food out for more than 2 hours or 1 hour if it is hotter than 90 degree Fahrenheit outside. If the temperature is too high, more than 90 degree Fahrenheit outside, then you cannot keep food for more than 1 hour outside at room temperature. You cannot. Keep your refrigerator at 40 degree Fahrenheit or below and know when to throw food out. Refrigerate perishable food within 2 hours. Within 2 hours, you have to keep the food into refrigerator. If outdoor temperature is above 90 degree Fahrenheit, then refrigerate within 1 hour. Okay, thaw frozen food safely in the refrigerator or in cold water or in microwave. Okay, so what they are saying is thawing process. Thawing process means warming up. So let's say you kept the food into freezer. Okay, now you want to use that frozen food. So generally, most of the people, what they do is they take out the food from the freezer and they keep on uh, a table or in the kitchen and counter on the kitchen counter they keep it and they leave it like there for 2 hours 3 hours like that because they think that okay food when the food will be warmed up or maybe when the ice is melted then they are going to use it. But if you keep like that and allow that food to thaw by itself living on counter kitchen counter, this food is going to be wasted because there are microorganisms they are going to grow. So that's not the proper technique. So as soon as you take out the food from freezer, how you can thaw that food? So either you keep that food directly into the microwave, or either you keep that food into cold water, or either you keep that food into refrigerator and allow thawing. You cannot keep them outside at room temperature for 1 hour 2 hour or 3 hour to get it warm by itself because it will allow bacteria to grow. And that's what most of the people do. What you need to do as soon as you take out any frozen food, directly you keep in the microwave or directly keep in the cold water or in the refrigerator. Okay, so even if the ice is melting in refrigerator, the temperature is not going to be decreasing. Temperature is not going to be increasing more than 40 degree, right? Because in the refrigerator, the temperature is less than 40 degree Fahrenheit. Never throw food on the counter because bacteria multiply quickly in the parts of the food that reach room temperature. So very, very, very important principle. So overall, we talked about separating principles. So separate everything you need to keep separate, specifically from non-vegetarian item with vegetarian item or non-vegetarian item with, the food that is ready to eat. You cannot keep them together. Then we talked about cooking principles. So cooking temperature is very important. 145 degree to 165 degree Fahrenheit is the best temperature that you can use to cook the food to kill all the microorganisms. Then we talked about chilling principle. So the temperature in the refrigerator should be less than 40 degree Fahrenheit. The room temperature, which is danger zone, that is between 40 to 140 degree Fahrenheit. So this is the temperature where you cannot keep the food for more than 2 hours. You have to keep the food into refrigerator. If outside temperature is more than 90 degree Fahrenheit, then you have to be very prompt keeping the food into the refrigerator within 1 hour. Okay. So these are the principles that we discuss about. And the first principle was about the cleanings, that so that you have to wash your hands and vegetables, fruits, and everything. Okay, now we are going to talk about the type of the diet. So one is therapeutic. In the therapeutic diet, that means there are different type of the diet that we can use for the patient. So the first one is a clear liquid diet. For which patient we can use clear liquid diet? The patient who have undergone surgery or who have undergone specifically gastrointestinal surgery on our, and the patients who are not allowed to eat solid food, they are on clear liquid diet. So clear liquid diet that is used as an initial feeding after complete bowel rest. Okay, so if patient was under general anesthesia, then there would be paralytic ileus, and we want to, we don't want to give any solid food that the patient's digestive system cannot digest. So first we start with clear, and then slowly we transit, from clear to solid food. So clear liquid diet is used for the bowel preparation for surgery. Even if any patient is going for GI surgery, then for the bowel preparation, we ask the patient to be on clear liquid food for at least 1 or 2 days. Specifically for if you are sending patient for a screening test colonoscopy, then there is bowel preparation. So previous day or 2 days before, the patient will be on clear liquid diet. Or if you are sending patient for any diagnostic test, as well as the post operatively after surgery, or in the client with the fever, vomiting and diarrhea, or if the patient has any gastroenteritis, meaning any food poisoning related diarrhea or any viral infection going on, and patient has diarrhea, then generally we will give clear liquid diet to the patient. Okay, now this food does not have much energy or calorie nutrients, but they are easily digested and absorbed. So they are lacking in energy, calorie, and nutrients, but they can easily get digested and absorbed very well. And they are transparent to the light and are liquid at body temperature. I want you to remember this sentence. Okay, I want you to remember this, that they are the food is transparent to the light, and please underline that, highlight. Okay, highlight this with your favorite marker, that the food is transparent to light and are liquid at body temperature. So if you just understand this principle, it would be easy for you to choose the right option for clear liquid diet. So examples, what are the clear liquid food items? Water is the main one, which is transparent. Bouillon, that is broth made by stewing meat, fish, vegetables in water. So basically broth means it's a water. So if you're boiling any vegetable, so whatever water is there, if you drain out that water, that's called broth. Clear broth or carbonated beverages, gelatin, hard candy, because if you suck on the hard candy, that's a liquid, that's a water. Lemonade, ice pops or popsicles. So popsicles are also considered as a liquid, clear liquid diet, because if you keep popsicles at room temperature, it's going to melt, right? And the regular or decaffeinated coffee or tea, regular or decaffeinated coffee or tea. So these are the examples of the clear liquid diet. So I was talking about these popsicles. So these popsicles, if you leave at room temperature, it's going to be converted into water. So that's a clear. Transparent. Jello. So jello is considered as transparent. This is hard candy, carbonated beverages, decaffeinated coffee or tea. These are clear liquid diet. By limiting caffeine intake, an upset stomach and sleeplessness may be prevented. So you have to remember this. If whenever patient comes with a complaint of insomnia, ask them to avoid caffeine in the evening time or before bedtime. Otherwise, patient will not be able to sleep properly. If someone who has upset stomach, then also they have to avoid caffeinated beverages. The client may consume salt and sugar. Dairy products and fruit juice with pulp are not clear liquid. So this highlighted in yellow points are important for you to choose the right answer. I don't want you to make any mistakes here. Even if it's very simple thing, most of the students make mistake here while choosing, right option for clear liquid diet. So any patients who have undergone surgery, remember that we start with clear liquid. So what are the food item that you can choose? You can choose any of the items from this image or slide. So remember, dairy product like milk, ice cream, fruit juice with pulp are not clear liquid. Are not clear liquid because they're not transparent. Instruct the client doing bowel preparation to avoid liquid that contain red or purple dye. So I was talking about the colonoscopy. So if the patient is going for colonoscopy screening, then if the patient is taking any watermelon juice or red, because it is in red color, right? So watermelon juice or something with red or purple dye, and if they go for colonoscopy when they are visualizing the area, the doctor can get confused between the food items and bleeding. So you have to be very careful that you educate to your patient for the bowel preparation that they are not allowed to eat any food items that is red or purple color in a purple color, okay, which can mask the normal color of the lining of the colon. Monitor the client's hydration status by assessing the intake and output, assessing weight, monitoring for edema, monitoring for signs of dehydration, monitoring the signs of dehydration. Each kilogram, meaning 2.2 pound of weight gain or lost is equal to 1 liter of fluid retained or lost. So what they are trying to say is, if any patients, if I do have like with chronic kidney disease or heart failure, I require to check the daily weight of the patient. Okay, so today the patient's weight was, let's say, 165 pound. And the next day, when I check the patient for the same time, same clothes, same weighing machine principles, if I'm using, and still the patient has weight gain of 170 pounds. So patient is 170 today. So how much is the gain? 165. What they are saying, at least 1 kg or 2.2 pound. 2.2 pounds. So definitely it is more than 2.2 pound here. Then it is required to inform to healthcare provider because it says that there is fluid retention. So they are saying that if patient is gaining 1 kg, that means 1 liter of fluid is retained. Or if the patient is gaining 2.2 pound, that means that the patient has retained 1 liter of fluid. If the patient is losing weight, that is the same thing. 1 kg of loss is equal to 1 liter of fluid loss from the body. Okay, next is about full liquid diet. So full liquid diet may be used as a transition diet after clear liquid following surgery, or for the client who have difficulty in chewing, swallowing or tolerating the solid food. Now, these are the patients who will be on full liquid. Full liquid diet, that means it is not transparent, it's a full liquid which will have some calorie and nutritional value, but it's not completely solid. So between solid and clear liquid food item, the patient is going to take full liquid who is not able to chew the food or is not able to swallow or who is not able to tolerate any solid food. So this food is not transparent anymore. This food is clear, but it's opaque, clear liquid food. Okay, not transparent, but it's opaque. Now those that are liquid at body temperature. Now food include all clear liquid and items such as plain ice cream, sherbet, breakfast drink, milk, pudding, custard, soup that are strained, refined cooked cereals, fruit juice, and strained vegetable juice. Provide nutritional supplements such as those high in protein. So now this food item can be high, rich in protein as prescribed for the client on a liquid diet. So we do have some examples here. Now you can see here, this is not a part of clear liquid. This is a full liquid because there are fruit juice with pulp or there is a vegetable juice, but that's not transparent, right? It's heavy. And if you see here, custard or ice cream, so if you leave at room temperature, that's going to be converting into liquid, but it's still thick than the clear liquid. And refined cooked cereal is also considered as a full liquid diet. So don't get confused. Refined cooked cereal can be considered as full liquid diet. Okay, then we do have mechanical soft diet. So mechanically, we have altered the texture of a particular food item, which is hard to chew. So we have changed their texture. So provide the food that have been mechanically altered in texture to require minimal chewing. Used for the client who have dental problems, surgery of the head and neck, or dysphagia. Require swallowing evaluation and may require thickened liquid if the client has swallowing difficulties. Food to be avoided in mechanically altered diet include nuts, dried fruits, raw fruits, vegetables, fried food, tough, smoked, salted meat, and food with the coarse textures are not soft diet. So basically, we are altering the texture of hard to chew food. We are making we are altering the texture and making this food item easy to swallow or easy to chew for the patients who have difficulty chewing. So this soft diet used for the client who have difficulty chewing, swallowing, and used for the client who have ulceration of the mouth, gums, oral surgery, who cannot chew properly, or who have broken jaw, plastic surgery of the head and neck, or dysphagia, or for the client who has had a stroke. Drinking fluids through a straw may be easier than drinking from a cup or a glass, or a straw may not be allowed for the client with dysphagia because of the risk of aspiration. All food and seasoning are permitted. However, liquid, chopped, and pureed food or the regular food with a soft consistency are tolerated best. Raw fruits, vegetables, fried food, and whole grains should be avoided. Raw fruits, vegetables, fried food, and whole grain items should be avoided in soft diet. Okay, now this one is important. I want you to underline this topic, low fiber and high fiber diet. Low fiber is also considered as low residue diet. In easy terms, if I explain, then low fiber or low residue diet means the food that get easily digested and can easily eliminated from body. Okay, supplies food that are least likely to form an obstruction. So there is no way that these food items can make or cause obstruction when the intestinal tract is narrowed by inflammation or scarring, or when GI motility is slowed down. So there is very important point here. Please remember for the exam, whenever patient has any inflammation, any inflammatory condition like diverticulitis or inflammatory bowel disease, so in that condition you cannot give the patient high fiber food. You have to give low fiber food because these fibers irritate to inflamed mucosa. Remember this, whenever there is inflammation present like chronic ulcerative colitis or inflammatory bowel disease, diverticulitis, or any gastroenteritis condition, generally you will prefer low fiber food, not the high fiber, because fiber irritates inflamed mucosa. Remember this, and these low fiber food are not going to cause obstruction. Okay, and specifically when the patient has decreased GI motility, you can use these food items so patient can easily digest them. Now, used for inflammatory bowel disease, partial obstruction of the intestinal tract, gastroenteritis, diarrhea, and other GI disorder. What are the nursing considerations? So I want you to remember the food item for low fiber diet. So white bread, please remember the multigrain bread. You will see in the exams options multiple times multigrain bread. So wherever there is multigrain word, please remember multigrain word, it is always high in fiber, high in fiber. If I use the word multigrain bagel, that's also high in fiber. Whenever they used multigrain word, multigrain is always rich in fiber. So here they are using the word white bread. So that's not multigrain, it's a white bread. So white bread, refined cooked cereal, cooked potato without skin because skin has more fiber, white rice, refined pasta. So these all are low fiber diet, low fiber diet. Okay, food to limit. See, if I give you example, if we do have any GI condition going on, upset stomach or something, what our parents ask us to eat? Maybe they will say, okay, eat rice and curd, right? So rice, when they ask us to eat rice, maybe khichdi or something, right? So when they ask us to eat rice, so rice is a carbohydrate, easily digestible food. Okay, now here you cannot teach Western culture to eat khichdi, right? So what you're going to tell them, if they eat cooked cereal and pasta, then pasta is easily digestible for them. So instead of khichdi or rice, you are recommending them to eat pasta. Remember for the exam, easily digestible food is pasta, but it has more carbs. So you have to be very careful while advising pasta for the patients who have diabetes because it's going to increase the sugar in that patient. Okay. Now, food to limit or avoid are raw fruits, because raw fruits and vegetables has more fibers. Any patients who have constipation, you are going to give fiber rich food, right? So in that, vegetables and fruits are the more important because it has more fibers in it. So if you have to avoid fiber, low fiber, then you are not going to give, or you are going to limit raw fruits like raw fruits or vegetables, nuts, seeds, plant fibers, and whole grains. Okay, because vegetables, nuts, seeds, plant fibers, and whole grains are rich in fiber. So you cannot give that food item in the patients who have active inflammation going on. And another important, dairy product, you should not give more than 2 serving a day. You should not give more than 2 serving a day. So overall, if they ask you a question about any GI upset, and if you want to give advice on the food item in general, right? Okay, what item you should eat and what item you should not eat. In that condition, you always avoid dairy product because dairy product cause stomach upset because it causes bloating. It is heavy to digest. So avoid dairy products, avoid caffeinated beverages, dairy product, even if the patient is not intolerant to it, but it is better to avoid dairy in general when patient has any upset stomach. So white bread, mashed potato, cereal, these are the food items which is low in fiber that you can give to the patient. High fiber, high fiber. So when patient has constipation, irritable bowel syndrome, this is not inflammatory bowel syndrome. Okay, this is irritable bowel syndrome where patient has episode of constipation or diarrhea because of their stress and anxiety. When the primary symptom is alternating with constipation and diarrhea, or a symptomatic diverticular disease, in that condition you can give high fiber diet. Now we talked about diverticulitis in previous slide. Diverticulitis, it's an inflammation of diverticulosis. Now what is diverticulosis is, it's a pouch formation in a colon. So there are pouch, small holes, kind of pouch are being created in the colon. So what happens is when the patient eats the food which contains seeds or nuts, then there is higher possibility those nuts and seeds can get trapped here. Or if the patient has constipation, then this pouch will be getting trapped with the food and cause problem, infection, inflammation, and can lead to diverticulitis. So culosis is outpouching and culitis is inflammation in the pouch system. So when there is culosis but not inflammation, that time you can give high fiber food. But if there is diverticulitis, then you can give low fiber food. Low fiber food, you need to remember this. High fiber food are fruits and vegetables and whole grain products. Increase fiber gradually and provide adequate fluids to reduce the possible undesirable side effects such as abdominal cramps, bloating, diarrhea, and dehydration. Okay. All right. Now, what are the gas forming food? So this is the whole list of gas forming food. So there is one question when the patient is having colostomy bag, or if patient has in general, stomach upset. So generally we avoid gas forming food. So you need to know like which food are gas forming. So basic food items you need to remember. Beans always cause gas. Okay, gas formation. Beans, then green leafy vegetables. Green leafy vegetables. If you might have heard of cauliflower. So cauliflower family का और क्या है? Broccoli. cauliflower, broccoli, cabbage, they look kind of same, right? So these all are gas forming. You might also have heard of onions. So if you know these food items which are most common and it causes, gas, then other options are kind of easy, or maybe you can remember from this list there is onion, there is cabbage, and Brussels sprouts are look same like cabbage, but they are tiny. Broccoli, what else? Milk, I just talked about. Milk causes gas formation, so you can avoid milk. Mm, what else? Radish, soybean. Okay, so radish, muli. Okay, muli. So these are the food items that you can avoid in general if the patient has any problem with the GI issues. Okay, now we are going to learn about the specific diet for the specific electrolyte. These things we have also discussed in fluid and electrolyte chapter, but this is more of a revision kind of thing. So let's talk about it. Potassium. So potassium, I'm going to ask you to underline the important food items which are rich in potassium. And please underline in your note and try to remember those food items. It would be very easy for you to, choose a menu in the questions. Okay, so potassium rich, remember banana, avocado, cantaloupe, orange, and strawberries. So A, B, C, O, S. A, B, C, O, S. A, avocado, B, banana, C, cantaloupe, O, orange, S, strawberry. So these are the food items that patient, we can advise to the patient who is deficient in potassium. What are the other vegetables? So vegetables, broccoli, asparagus, carrot, potato, tomato, spinach. These are the food items, vegetables that you need to remember. Okay, asparagus, broccoli, carrot, potato, tomato, and spinach. There are some non-vegetarian items too, nuts, raisin, and very important salt substitute. If the patient who has high blood pressure and if they are using salt substitute, you have to be mindful about high level of potassium in salt substitute. Okay, so A, B, C, O, S, then asparagus, broccoli, carrot, potato, tomato, and spinach. These are the potassium-rich food items. Sodium, as we have talked about, canned food, frozen food, the food that has preservatives like tomato ketchup and all. The food items that are ready to cook or ready to eat from outside when you buy, okay, that has preservative in that. Pickles, these are the food items that contain lots of sodium. Soy sauce is very important and high source of sodium. And please don't forget potato chips. I always give you examples of Lay's chips. If you eat potato chip, then at the end your fingers will be salty, so you can remember too much sodium in there. Okay, and smoked food, highly seasoned food. So students who don't eat non-vegetarian items, they will have hard time understanding smoked food because most of the time they will, give you options like salami or pepperoni pizza. So these are the smoked bacon, sausage. These are highly smoked or seasoned food items, ham, non-vegetarian item. Okay, so you will see this in the options. So let's read non-vegetarian and bacon, frankfurters, lunch meat, cured meat, hot dog, ham, food, processed food, canned food, snack food like pretzels, potato chips, salad dressing. So that means whatever sauce are you using, it has sodium, high level of sodium. Red color, ketchup. Yellow color, mustard sauce. White, milk and butter also contain sodium. American cheese, table salt, black color, soy sauce. So these are the items that you need to remember. Okay, you can write it down multiple times, or maybe you can, write it down, draw some, vegetables and fruits, and you can put it on your wall and try to see that, poster multiple times in a day. You will remember. Okay, magnesium. So magnesium, fruits, dairy products, non-vegetarian items, and nuts. So fruits, avocado, vegetarian green leafy vegetables contains magnesium like spinach and broccoli. Others, potato, oatmeal, and wheat bran. Dairy, milk, yogurt, canned, white tuna, peanut butter, non-vegetarian item, food, pork, beef, chicken, soybean, and nuts, almond, and raisins. Potassium is important for the exam. Remember this. Potassium is important, sodium is important, calcium, vitamin D, and B12. These are the important um, um, food items to remember for the exam. Okay, so this is important slide. Calcium. So in calcium, what all things you need to remember. So as you know that milk dairy product is rich in calcium, but if someone who is following vegan diet who cannot eat milk, then you have to give them option of tofu is made out of soybean soy milk you can give to the patient. Okay, so dairy product, milk, yogurt, tofu, and soy milk, this is most important for the exam. Okay, tofu you need to remember. So cheese, milk, dairy product, yogurt, soy milk, tofu, high rich supply source of calcium. Green leafy vegetables, Brussels sprout, collard greens, spinach, rhubarb, any green leafy vegetables are rich in calcium. Non-vegetarian item, fish, sardines are rich in calcium. Okay, so you can see here in this picture, so this side is all calcium, this side is all vitamin D, and in between, whatever the food item is there, that is rich in calcium and vitamin D both. So there is milk, yogurt, tuna, salmon, cereals, fish, right? This side dairy, ice cream, green leafy vegetables, soy, tofu, almonds. The other side, vitamin D, rich source, fish, egg yolk, cod liver oil, and tuna. Vitamin D, fat-soluble fortified and full-fat dairy product like milk and cheese, fish oil, cereals, and sunlight. These are the sources of vitamin D. Phosphorus, if you can remember, non-vegetarian items like beef, chicken, fish, organ meat, pork, nuts, and whole grains are rich source of phosphorus. I want you to remember iron sources, okay? Iron sources, because there is a question that the patient is following vegan diet. There is a mother who is in 28 week of gestation or 22 week of gestation who comes for the prenatal examination and she's following vegan diet. How the nurse is going to prepare menu for her, or how nurse is going to educate her to eat the food items, the nutrients. So iron you have to include B12, because in one non-vegetarian item there would be iron, there would be B12, and if the patient is not taking dairy food, then there would be deficiency of calcium, right? So the dairy, so if so dairy, you have to eliminate the animal sources, so you cannot give milk, egg. So how you are going to replace this calcium in the patient who is following vegan diet? So you have to give green leafy vegetables for the calcium sources, okay? Or you can ask them to take tofu or soy milk, okay? So these are not the animal products. So if patient is following vegan diet, iron, B12, green leafy, tofu, and soy milk. These items you can give to the patient. So iron, other sources you can see here, non-vegetarian items, beef, egg yolk, liver, and red meat, seafood, okay? Now vegetables, dark green leaf vegetables, green beans, and potatoes. So they are rich in iron. Some fruits like carrot, prune juice, apricot, and dry fruits. Dry fruits has iron. Now, one thing I want to tell you here, let's say a person who is from rural area, okay, who does not have enough money to buy dry fruits. For those patients, what is the easiest way to give them advice? So I always recall my experience when we were working in rural area, when we had posting for community health nursing program. Poor people who don't have money to buy all this stuff, so government always give them some food supply, food items, and we always notice that in that food item there is always wheat flour. So when we give wheat flour, we have to teach them, what are the food items that you can make from this wheat flour. So we used to make sukhdi, or we used to make laddu from wheat flour, adding jaggery. We used to teach them that you can use wheat flour, little bit ghee or butter, and add jaggery, and you can eat those laddu specifically in postpartum period. And I still remember educating those postnatal mothers or the mother who are antenatal, because it's a easy and cheap, we can say economically, who do not have more money, the easy things to buy from any local store, and you can make this kind of food items. So remember, the wheat contains lots of iron. So you can see here whole grains in that. There is a bread, cereals, oatmeal from wheat, raisin bran from wheat pasta, spaghetti noodles from wheat items. So you can see the wheat is a food rich in iron. So sometimes they will ask you multigrain bread, you can use that. So not only it is rich in the fiber, but it also is rich in iron, so you can use that wheat food items, the food items which are made out of wheat. Folic acid, whenever mother is pregnant, we start giving them supply of folic acid to prevent spina bifida. So green food items, avocado, asparagus, broccoli, Brussels sprout, turnips, mustard green, spinach, green peas. So all greens are high source of folic acid. Fruits, citrus food item, orange juice, tomato juice, grapefruit, rich of folic acid. Whole grain, fortified cereal, rice, pasta, spaghetti, bread, seed, sunflower seed, nuts, peanut butter, folic acid, non-vegetarian items, and legumes, cooked dried beans, and lentils. Okay, vitamin C, all citrus fruit contains vitamin C. Strawberry, orange, tomato, cantaloupe, vegetables, green pepper. Green pepper is also rich in vitamin C. Broccoli, cabbage, potato, and spinach. Zinc, non-vegetarian item like egg, meat, protein-rich food, vegetables, leafy vegetables. Vitamin A, all yellow and orange fruits and vegetables are rich in vitamin A. Okay, so that is good for your eyes. So apricot, broccoli, cantaloupe and carrot, pumpkin, orange or yellow, winter squash, orange or yellow, sweet potato, and spinach. Dairy, butter, margarine, milk. Non-vegetarian, liver and egg yolk. That's vitamin A. Vitamin E, apricot, avocado, apple, mango, peach. Vegetarian margarine, vegetable oil, salad oil, green leaf vegetables, cereals, nuts, and seeds. Now, you might be wondering how you're going to remember all these food items. So as I said, try to remember calcium, try to remember potassium, sodium, vitamin B12, and vitamin D. These are the most important, food items, resources that you need to remember. Vitamin K. Vitamin K also you need to remember because there is one question. Whenever patient is on warfarin, you need to limit or eliminate vitamin K. You need to limit. Okay, why? Because vitamin K is antidote of warfarin. So you need to eliminate or you need to limit whatever amount you are taking. You have to continue to take the same amount every day. You cannot all of a sudden increase vitamin K. Otherwise, your warfarin will not be effective anymore. So vitamin K, all green leafy vegetables contain vitamin K. So you can see here green leafy vegetables like asparagus, broccoli, sprouts, cauliflower, cabbage, kale, lettuce, peas, spinach, and green pepper, all green leafy vegetables, and non-vegetarian liver, meat, and other soybean oil and milk. So please remember green leaf vegetables. Green leafy vegetables are rich source of vitamin K. Now, vitamin B, B2, B6, B12, I would recommend to remember B12. So all non-vegetarian item contains vitamin B12. So people who are vegetarian or vegan, they have always vitamin B12 deficiency because they are not eating meat item. So non-vegetarian meat, liver, egg and shrimp, milk products, soy milk and enriched cereals are rich in vitamin B12. Okay, so these are the food items. These are the vitamin sources that we learn and you need to remember. The one important topic that I want to discuss here. Let's talk about this. The type of the vegetarian. Okay, so we do have a few types. Lacto, ovo vegetarian. Types of the vegetarian, okay? Types of vegetarian. Lacto, ovo vegetarian, lacto vegetarian, vegan. Okay, these are the type of vegetarian that we need to understand. Now, easy way to remember. O means egg, and lactose, something related to milk, right? Lacto. So L means milk. Now, sometimes if I ask any person, okay, are you vegetarian? They will say, yes, I'm vegetarian. And when I ask them, okay, fine. And then after a while, they will say, okay, egg. I eat egg, but not meat. So egg is also animal product, right? So there are different type of vegetarian people. So when I say lacto-ovo vegetarian, so in lacto-ovo vegetarian, there is word lacto and ovo. There is word lacto and ovo. So what is the explanation of this? The whoever is lacto-ovo vegetarian, they take milk, they take egg, but they don't eat meat. Okay, so remember this way, wherever there is lacto and ovo word are present, that means they eat egg. O means egg, lacto means milk, but they don't eat meat. If I say ovo vegetarian, so this ovo people take egg, but no milk or meat. If I say lacto vegetarian, the person take milk, but no egg and no meat. No egg, no meat. Any person says vegan, so there is no lacto word, there is no ovo word. That means they don't take milk, they don't take egg, and they don't eat meat. Okay, so according to the practice that they are following, you can prepare the menu for these patients. Okay, so we are done with nutrition chapter. If you have any question, let me know. Thank you.